Hi guys, this is Alicia with Good Morning Sunshine. So today we had 4 lectures. I'm going to go over 3 of them with you because I'm still waiting on the bacteriology PowerPoint. But we had pharmacology today and then 2 lectures of parasitology. So we had our first exam for dealing with reds yesterday. So this is all new material going on the next exam on the 15th. So again in 2 weeks. But a lot of material. It's much harder this time. I think this exam's gonna be much harder than the last one. And the last one was already brutal. So anyways, I'm gonna start off with pharmacology. So today we started antibacterial agents for systemic therapy, so cell wall inhibitors. So we did B-lactam antibiotics. So those are things like penicillins and cephalosporins, and glycopeptides, which is not on the test, so she vaguely didn't really go over that, so I'm not going to go over that with you. So starting, B-lactam antibiotics includes penicillins, the cephalosporins. They also include carbapenems, so that includes imipenem and meropenem, and then it also includes monobactams, which entails aztreonam. But anyways, all these drugs have a beta-lactam ring. So B-lactam antibiotics mechanism of action is to penetrate the outer cell of the bacteria. So they bind to the penicillin binding proteins, also known as PBPs, in the cell wall. So these PBPs are enzymes such as peptidases. They are required for cross-linking of the cell wall precursors. The B-lactam ring mimics the cell wall precursors, and they prevent cross-links. So they bind to the active site on the transpeptidase, effectively inhibiting the cross-linking, like I said. They make holes in the cell wall so fluid can get in, and then, again, too much fluid, the cell will rupture and die. So going over it in a more defined way, so there's an inhibition of the cross-linking, there's open channels through the cell wall to create these pores, the holes I was talking about, and allowing fluid into the cell from these holes, causing the cell wall swelling and death. So next we went over back-lactam antibiotics, pharmacokinetics in general. So they have low plasma protein binding, they distribute well to the interstitial and extracellular fluids in most tissues. They're hydrophilic, so minimal intercellular concentrations, and they do not distribute well to protected sites such as the CNS, so the central nervous system, the eye, and the prostate. Also, for elimination, so how they are eliminated is through glomerular filtration and tubular secretion, and then also for very high concentrations in the urine. Also short half-life and require frequent dosing, so exceptions being, of course there's always exceptions, being sevofecin, ceftriaxone, crystalline-free acid. But some post-antibiotic effects against gram-positive bacteria, and those are your penicillin, and so an example would be penicillin and streptococci. So, and then we got into the pharmacodynamics of the B-lactam antibiotics. So time dependent, so efficacy is based on how long the concentration stays above the MIC. So if time is greater than the MIC, we want this, so 50% of the dosing interval, we want that above the MIC. So if immunosuppressed or severely ill patients, we want the time, so that time above the MIC to be 90 to 99% instead of just the 50%. So penicillins, we're going to start with benzyl penicillins, so that's penicillin G. Penicillin G was the first B-lactam. It was the first penicillin and the first antibiotic. It is still effective against streptococcus species, some anaerobes such as Clostridia. Some gram-negative bacteria are usually resistant, so we don't use penicillin to treat those. These are bacteria such as E. coli, the Klebsiella, and Pseudomonas. Also inactivated by B-lactamases, it breaks down the beta-lactam ring, so that's bad. Staphylococci, plus or minus, produce beta-lactases that inactivate penicillin. yeah. So penicillin G is the oral absorption is limited, so and it's also degraded in gastric acid before it gets to the small intestine. Usually it's of IV formulations, so intravenously, potassium or sodium salt, and also it costs a lot, so human products cost a lot. However, IM and sub-Q formulations, they're FDA approved for many veterinary species, complex with procaine and benzathine. They have longer half-lives and can be dosed less frequently. So, and the veterinary products aren't as expensive. So, effective formulation and pharmacokinetics and efficacy. So, why benzathine penicillin sucks? This is what our professor went over because she thinks it sucks. It's because that drug sticks around at the subtherapeutic concentrations. So I guess the labels are also wrong on these drugs because the MICs were much lower way back then. So they used to be at 6,600 IU per kg, but now they're at 22,000 IU per kg. So thus we need to give a higher dose of these drugs now. So showing you this graph to tell her why she hates the benzathine penicillin. So you're supposed to give it like every 48 hours, so that was supposed to be good, right? But no, look. So here's the MIC. And that's means the inhibitory concentrations, the minimum inhibitory concentrations. Sorry, I meant to say what MIC meant. I talked about it the other day, but anyways, here's the benzathine penicillin. So look, it only goes above the 50% line that I was talking about for only like 2 seconds. But so it's not a really good drug. It's just stays at therapeutic levels, so. And then we got into aminopenicillins. So the drugs in this class that we're going to be discussing is ampicillin and amoxicillin. They're good oral absorption in small animals. So amoxicillin is the better one given orally. Ampicillin is more commonly used for IV, IM, and sub-Q injections. It's limited to no oral absorption in large animals, however. So increased spectrum against gram-negative bacteria still maintain activity against gram-positives and aerobes, and it really only applies to the urine. So used very frequently in small animals. It's the number 1 in cats and the number 2 in dogs, so aminopenicillins. And then we got to extended spectrum penicillins, so limited use, these are things we're not being tested on in class, so I'm not going to go over those with you. And also the anti-staphylococcal penicillins were also not being tested on, but those are methicillin and oxacillin. There's little activity against gram-negative or anaerobic organisms in these. Methicillin, so oxacillin, same thing, is resistance to staph. So MRSA, MRSA, and MRSP, this is bad, going to be resistance to all antibiotics we were talking about today. So bacteria reported resistance to oxacillin should also be considered to be resistant to all other B-lactam antibiotics, which is bad. So getting into cephalosporins now. So classifications, there's first, second, third, or fourth generation. These increase gram-negative in the higher numbers. So the higher the number, so first generation has to do with gram-negatives. Sorry, have to do with gram-positive, and as you go down to second, third, fourth, they turn into gram-negatives. So we're going to start with first generation drugs. So they're the highest activity against gram-positive bacteria. So also including some beta-lactamase positive staphylococci. It includes cefazolin, which I know, cefadroxil, and cephalexin. Cephalexin I also know. Cefazolin has the most activity against gram-negative bacteria. Cephalexin is the most common antibiotic prescribed for dogs. However, she doesn't like it because it apparently gave her dog diarrhea. I don't know. But then we have our second generation drugs. So they're good gram-positive activity and anaerobe activity. So greater activity against gram gram-negative bacteria. In general, activity against gram-positive bacteria is similar. It includes the cephooxytin, cefotetin, and C. faecalis. So example, anaerobes and dental disease, we need to know these for our second generation drugs. So then we have our third generation cephalosporins. So they have the most activity against gram-negative bacteria. Activity against gram-positive is less than the first and second. Like I said, it's going down, starts at gram-positive, slowly goes down to gram-negative. The exception being cephalosporin and streptococci. It includes, again, cephalosporin, cephalosporin, and cephalosporin, also known as Sympacef. Ceftazimine and cefotoxamine are used with pseudomonas and CNS infections in humans. And then we have our fourth generation cephalosporins. They include cefepime and cefequinone. They're broad spectrum drugs. Cefequinone is currently available in Europe and the UK for veterinary use. They have their approval for BRD, but they were denied by the FDA. So, fourth generation are rarely used in veterinary medicine in the US and in any species. So our first generation drugs, just to put in a chart for you guys, here we go. First generation, cephalexin, cepaxilin. Our third generation is the ceftiofor, the cefopoxamine, proxytil, that's Sympacef, and cevoxin. So cephalosporins continue getting more into first generation cephalexin. So that's the oral use in dogs and cats. It's FDA approved chewable tablet in dogs, and dermatitis caused by non-methicillin oxacillin resistant staphylococci. So in cepaxilin first generation, it's used for IV use in dogs and cats and sometimes the horse. Extra label use is for the human product. It's usually used in surgical prep, so pre-operations, administer within 60 minutes of the incision, and then you want to give every 90 to 120 minutes until wound closure. So during surgery, you'll be giving this every 90 minutes approximately as well, which we did in surgery. Cefodoxamine, also known as Sympacef, is a third generation. It's labeled for use in dogs, so skin is used for skin and soft tissue infections. Has been used safely in cats and fowls, but not in adults. So the longer half-life, it has a longer half-life, once daily dose, better, and it has better owner compliance due to this once daily dose. It's a prodrug. Ester improves oral absorption. So then we have cefovecin, which is a third generation. It's FDA approved for the treatment of skin infections in dogs and cats. This is also known as Convenia, which we used at the clinic I worked at. And then it's a single subcutaneous dose. It provides therapeutic concentrations for up to 14 days. It has a long half-life due to the high affinity protein binding, about 98% actually. So it loves proteins actually more than it loves liver enzymes. It shouldn't be used for abscesses or CNS disease. The dose is usually high and more for non-life-threatening infections, though. It is the number 2 antibacterial in cats. And then a word about long-acting antibiotics she wanted to point out is once they are administered, there's no turning back. Effects are persistent longer, adverse effects last longer, so not fast-acting, don't use for severe and life-threatening infections. So then we got into ceftiofor, which is third generation, so it's FDA approved for use in dogs, but not usually used in dogs. It's more used in horses, chickens, and turkeys, cattle, goats, sheep, and swine. It is a main cephalosporin used systemically in large animals. So the 3 formulations available are cetiapher sodium, cetiapher hydrochloride, and cetiapher crystalline free acid, which is Exceed, known as Exceed for long lasting. Third generation, but higher doses needed for gram-negative bacteria. Cetiapher crystalline free acids, also known as Exceed, like I just said, are complex in cottonseed oil. They're long-acting, long half-life due to extended release formulation. is a single subcutaneous dose at the base of the ear in a cattle. And you're probably wondering why we put it in the ear of a cattle. Well, at slaughter, their ears get thrown away, so their residue stays around for a long time. So this is why it needs to go here, so it's not still on the cattle when it goes to slaughter. It's a single IM dose in swine. IM doses in horses repeated once in 4 days. So, however, what's common is injection site reactions. So we need to tell the owners of this because they are very common. And then we talked about extra off-label use in food animals. So prohibited by the FDA in major food-producing species. That includes cattle, swine, chickens, and turkeys. So everything has to be on label when you're doing drugs for these. Exceptions being the cephalosporin, which is a first generation, and that can be given off-label to these food animals. So indications not on the label, all other label indications have to be met, like the dose, route, duration of therapy. There's no prohibition in minor food. So those include sheep, goats, honeybees, fish, wildlife, because they're not eaten by us very often. And then we got into the adverse effects of these B-lactam antibiotics. It's relatively rare, however, hypersensitivity reactions happen, like anaphylaxis and IMHA, so immune-mediated hemolytic anemia. Cross-reactivity between penicillins and cephalosporins may exist, about 15% in people, and then at very high concentrations can inhibit GABA in the CNS, so it causes CNS excitement and seizures. It can occur with other B-lactams as well. Procaine reactions, so this is your procaine penicillin. It is the reaction with the procaine. It's not a reaction with the penicillin. It can be fatal if you accidentally give a whole dose of procaine penicillin IV into a horse. This could actually kill a horse. If it doesn't go full IV, sometimes they would just have seizures for for like 10 minutes, but it's really scary, so you want to make sure you're not going into a blood vessel when giving this. And some gastrointestinal effects in dogs and cats is vomiting with higher oral doses due to irritation of the gastric mucosa. And then in horses and rabbits, it's high incidence of antibiotic-associated colic with oral administration. And then positive Coombs test without anemia. It's rare though. False positive glucose test on UA. If copper reduction test used, that's also rare. And anemia and thrombocytopenia with high doses of some cephalosporins. That is also very rare. So adverse effects, they're relatively rare. And then we got into B-lactam antibiotics drug interactions. So do not combine in a syringe. So if you have an amikacin plus a potassium, don't put them together in a syringe. Synergens, it'll cause inactivation, chemical inactivation when mixed. So again, do not put them together in a syringe. Then we got into B-lactam antibiotics mechanism of resistance. So this is where methicillin resistance come in. So it's genetically mediated via the MEC-A gene. It encodes for penicillin binding protein 2A, so very low affinity binding here for all B-lactam antibiotics. So it's resistant to all B-lactams, which is not good. This includes carbapenems and monobactams. And there's reduced penetration of drug into the bacteria, so gram-negative capsule, alter reduced number of porins, and channels that antibiotics can cause to cross the cell membrane. It is the number one is enzyme-mediated degradation. Beta-lactamases, penicillinases is the most common for inactivation. Cephalosporinases inactivate as well, and carbapenemases inactivate all of these, which is bad. And then we have B-lactamase inhibitors. This includes clavulanic acid, sulbactam, and tazobactam. Their mechanism of action, they combine with the B-lactamase enzymes to form an inactive complex, so gram-negative and gram-positive bacteria. Their co-administered antibiotic is then able to exert its effect, and it also binds to different PBPs. Has bactericidal effects and no sufficient to ever administration alone. Formulations combined with a beta-lactamase inhibitor that includes amoxicillin plus the clavulanic acid, that's Clavamox, which we use at our the practice I worked at. We also have the ampicillin plus sulbactam, which is Unison, which we also used at my practice. And then ticarcillin plus the clavulanic acid, that's Timentin. I haven't heard of that one. And then piperacillin plus tazobactam is Sossin, which I haven't heard of either. But that was it for pharmacology lecture. Now let's get into parasitology. So parasitology, we're now talking about Spirorita. We're again still in phylum Nematoma. And then Spirorita breaks down into Phyloroidea and not Phyloroidea. So we're going to start with the order Spirorita. So it's not in the GI tract. It's diverse. It has a diverse order, difficult to find general characteristics for it, but all members have an arthropod as an intermediate host. Parasitize a variety of tissues in the vertebrate host. Again, superfamilies are Phyloroidea and non-Phyloroidea. That's what we're classifying them as, at least in this class. So the superfamily Phyloroidea is called phylloreids. It's not in the GI tract. It's long, slender worms. And again, the arthropod is usually an insect used as the intermediate host. The females don't produce eggs in this case. You can't use a fecal test because they don't have eggs in the feces. They produce microfilaria. This is larvae. It's generally abbreviated MF. So if I say MF, that's what it means. It means microfilaria. Sorry, my throat's not doing well. Anyway, so this is also known as the pre-L1 stage. In other words, it's a stage between eggs and L1. So for these, we don't go by L1, L2, L3 stages. We go by microfilaria. So starting with Dirofilaria immitis, that's heartworm disease. So most important, it's heartworm. Most important, we can do a blood transfusion. Sorry, the heartworm is the most important out of these phylum nematodes, this class. The question was, can you do a blood transfusion with an animal who is positive for heartworm disease and give blood to an animal who is negative? The answer is yes. However, the negative animal won't be infected because the infectious stage of this disease is in the L3 of the mosquito, which I'll talk about its life cycle in a second. However, the negative animal will become a reservoir for the mosquito now. Thus, we have to treat for microfilaria of the negative dog so it doesn't become a reservoir. So again, heartworm, its definitive host is dogs and wild canids. This parasite of the pulmonary arteries primarily, sometimes in the right heart. It's long and thin, and females can be up to 28 centimeters in length, so they're really big. So its life cycle, its intermediate host is mosquitoes. So L1 to L3 are in the midgut of the mosquito. When L3, they go to the salivary glands of mosquito, then they bite dog, but they're still in L3. So L3 goes to the subcutaneous tissues to become L4. They go to the pulmonary arteries in order to go through sexual maturity. They appear in the blood as early as 6 months post-infection. So again, we are using the L's here for the heartworm life cycle. Its patency is about 5 years. And then we are getting into the Dirofilaria immitis pathogenesis. So damage roughly proportional to worm numbers, so probably no clinical signs with lower numbers. Disease components include some physical destruction of vessel by the worms. Worms cause inflammation in vessel wall and progressive fibrosis in vessels, so sclerosis. And also reduce cardiac output and compensatory right heart disease with severe disease. So the right becomes enlarged and it can create heart failure. and also a potential thromboembolism. So, but that's the worst case scenario of heartworm disease. And then some clinical signs for this disease is when number of parasite increases, the severity gets worse. So they start out as asymptomatic, which turns into a chronic cough, dyspnea, and decreased exercise tolerance. But then when the number of parasites keeps going up, this leads to syncope, hemoptysis, and congestive heart failure, and then ultimately it goes to death. The prevalence of this disease, the highest prevalence areas along the Mississippi and the East Coast. That's why my dogs are on heartworm here. I didn't have them on heartworm while I was in Reno, Nevada, because it's not as prevalent there, or at all, really. But here it definitely is, so I had to put them on medication. And then the diagnosis for this disease are antigen tests, which is most sensitive and widely used. We have an annual test recommended every year, so a heartworm test before you can actually get the medication by a vet. Microfilaria check, check peripheral blood sample to microfilaria, and also useful in testing. It's covered in detail in our other class, which we're going to take in the spring. And treatment for this disease, preventive is recommended because treatment is harsh and accompanied by risk of thromboembolism. But yeah, so you want to keep on my heart guard. And then the role of Wolbachia he wanted to go over in this disease, so Diarrhea immitis, is needed for the parasite for reproduction, so you need to eliminate the bacteria first. Many but not all phyllorid parasites have symbiotic bacteria. The Wolbachia, that's the symbiotic bacteria I'm talking about. So if bacteria is removed, the reproduction of the worms is blocked. So again, it's needed for reproduction. It reduces severity of the disease. Doxycycline is now being used in treatment of heartworm infections. But yeah. And then we got into the abnormal host for Diarrhea. So cats, this would be in cats. The life cycle is usually not completed. A cat can usually clear the infection. The diagnosis is more difficult in cats for this. There's no treatment for cats. It is actually a respiratory disease in cats, which is completely different what I was just talking about in dogs. The worms are less successful in cats. We're more likely to migrate to the abnormal sites than in dogs. Most affected cats show no signs, and the worms die soon after infection anyways. So let's get into other phylloria in North America. So yes, other phylloids occur in the U.S., but they are uncommon. Phyllorid parasites of subcutaneous tissue of dogs. Phyllorid parasites of horses is in skin in horses, can cause dermatitis. We have to be able to recognize when something might be a phyllorid. Long thin nematode, not in the GI tract basically, and the microfilaria are detected. So let's get into the not phylloria. So minor species producing eggs that are clear, elliptical shaped with a smooth, thick shell wall containing a coiled larvae. Adults are small to medium, but not thread-like. An arthropod is the intermediate host here. So not phylloria include Habronemia and Drachia. So those are in horses. They live in nodules in the equine stomach, the intermediate host being the stable and housefly. L3 can be deposited by mistake in other locations, such as the mucocutaneous junction and in wounds. The larvae invade areas and survive but don't develop. Causes summer sore. Persistent cutaneous granuloma can be mistaken for exuberant granulation tissue, such as neoplasia. So the adult in stomach. In the stomach, the equine stomach produces eggs. Then it goes to the environment. The larvae hatch, so L1. The flies ingest this. The parasite goes from L1 to L3. L3 being the infectious stage and salivary glands of these flies. The horse then ingests the fly, and then it goes down to the stomach to become adults. However, sometimes the parasites get out into the eye and other areas, like I said, in the skin, but it is not very common. So no phylloria are uncommon and or unimportant in domestic animals. We have Phyllopteria, usually asymptomatic, usually not pathogenic. They're a stomach parasite of wild animals, occasionally in dogs and cats. And then we have Alasia, which is an eyeworm, which is also zoonotic. So now let's get in the order. So this is also under phylum Nematoda, the order Enoplidia. So this order, a few members of importance in domestic animals without many common characteristics. Most in domestic animals produce eggs with 2 polar plugs. So here's what they look like here. And then infective larvae develops and remains inside the egg. So this is the infectious phase, is when that is the embryonated egg. They are just in the ground, and eggs are very resistant to environmental conditions. So under this order is Trichuris vulpes, which is a whipworm. It's not very pathogenic. It's in the large intestine of dogs worldwide. It has a whip-shaped body. Its interior end intertwined within layers of epithelial cells. It has a direct life cycle. Bipolar eggs passed in feces. The infective larva develops in eggs at least 2 weeks, and then the diagnosis is egg detection. So the eggs, again, are passed in feces. The dog ingests the infected larvae egg when it hatches, and it goes to the large intestine cecum and then develops into adults. That's its life cycle. And its prepatent period is 3 months, so impacts diagnosis and treatment. Many infections are asymptomatic. Its clinical disease is diarrhea plus or minus blood, and anemia if severe. Symptomatic cases seen in young and adult dogs. One of the big 3 worms of dogs, so about 19% prevalence in national survey. So other trichuris is pigs, ruminants, not cats in most of the U.S., only in Florida and other countries, and people have their own species. So again, under the order of Enoplidia is also Trichinella, which is very important. It's adult worms in the small intestines of warm-blooded animals. Its larvae produced penetrate the gut and cyst in tissues. It is important in zoonosis from ingestion of pork. Human disease is known as trichinellosis or trichinosis. Geographic distribution is worldwide and has a complete all life cycle in the host, none in the environment. So there's 4 things that are part of its life cycle. It's very complex, but I'm going to share those with you. So trichinella infection is caused by the ingestion of mussel containing encysted larvae. So after exposure to gastric acid and pepsin, the larvae are released from the cyst and invade the small intestine mucosa, where they develop into adult worms. The lifespan in the small intestine is about 4 weeks. After 1 week, the females release larvae that migrate to the striated muscles, where they encyst and may survive for an extended period of time. There's also a domestic cycle, which is between pig and rats. Also, this is in swine. So between pig and rats, the pig eats muscles of the rat, it gets infected, and then the parasite goes through its entire life cycle in the pig. So there's no environmental part in this. Humans can also get this disease by eating undercooked pig meat, and it can be fatal to humans. Then we have the sylvatic cycle, which is one host eating the meat of another host. Then the parasites goes through, again, the entire life cycle in that one host. And then we have another order. We have the order Oxyuridia, which are pinworms. They're usually small adults in the large intestine. Species in horses, rodents, ruminants, reptiles, and people. Usually not very pathogenic. It has a direct life cycle. And the eggs may have a polar plug, often flat in appearance on one side, and the diagnosis by detection of eggs in the feces. So that's what these guys look like, our little pinworms. So under this order, we have Oxyurus equi, which is again in a horse. It's a common equine pinworm in the small intestine. Its life cycle is infection from ingestion of eggs. Fertilized females migrate from L1 and rectum on the skin, glue eggs to hairs in the perianal area. It causes pruritus, irritation from warm movement in egg glue. They get a rat-tailed appearance, and the diagnosis is by finding eggs on the perianal skin using a microscope. They do not release eggs into the feces. Then we have a human pinworm under this order. So common parasite, especially in children. Transmission entirely person to person. It causes intense pruritus in the perianal area, but it has nothing to do with animals. And then the last order of the phylum Nematoda is the order of the Rabbitidae. neglected. It's not important, so he didn't really go over it, but most members are free-living soil nematodes. There's only one animal parasite genus, which is Strongyloides. Tiny adults about 6 millimeters. It's species-specific for ruminants, horse, dog, pig, and human. These eggs are common in manure samples for young ruminants, but it is a rare disease. So then we had one more lecture of parasitology. That was the first one. So now we're getting into phylum, platyhelminthes, taxonomy. So those are, platyhelminthes are then broken down into tapeworms and flukes. So tapeworms being Cystota, and then flukes being Trematoda. And then tapeworms and flukes, general characteristics, but there's always exceptions, but they're flat mostly. They're hermaphrodites. Their definitive host diagnosis is eggs, and they have at least one intermediate host. So starting with tapeworms, the class Cystota, they're segmented, often long, adults and host GI tract, almost always small intestine. Worms have no intestine, so they absorb nutrients across its surface, and they have at least one intermediate host. The adults often are non-pathogenic, but people repelled. The larvae most pathogenic stage is in the definitive host. So all adult tapeworm are divided into regions. So we have the scolex, which is also known as the holdfast, which is the head. Has suckers and or hooks, and it attaches to the gut wall. It also has a neck, which is the region of cell division. It gives rise to proglottids, which also known as segments, and it's also known as its body. So the segments mature as they travel down the chain, and the oldest segments are at the posterior end. So here's what these look like here. Each segment has at least one set of reproductive organs of both sexes, so they're classified as immature, mature, and then gravid. Gravid contains fully developed eggs. The last gravids actually separate from the body, so the worm won't die if you cut off a segment. So maturation occurs as it moves down the chain. A common tapeworm shed gravid segments, and they usually won't see eggs in the feces. So like here, you can see the segments. Those are gravids, but they are the ones that contain the fully developed eggs. So now we're in class Cystota. This is where the no L1, L2, L3 stage comes in, which I was talked about in the very beginning. But now it's happening. So tapeworms have at least one intermediate host. The general term for larvae, the larval tapeworm is metacestode, which are also can be known as larval stages. But this is in the intermediate host. There are many different morphological types of larval tapeworms, and each type has its own name. So class Cystota, this general life cycle is eggs from the adult tapeworm, and the definitive host is passed into the environment. The eggs are then eaten by the intermediate host. Then the definitive host eats the metacestoid in the intermediate host. That's how it becomes infected. So common tapeworms are the family Tianidae, which are vertebrates, are the definitive and intermediate hosts. We have family that are other. Those are the invertebrate as intermediate host and vertebrate as the definitive host. And then another tapeworm group has two intermediate hosts. But we're going to start with Tianidae. They are segments, square to rectangular in shape. In general, larval stages are the most important, and adults have little significance. The eggs pass from the host in segments. Usually infection recognized from seeing segments. Eggs seen infrequently in fecal exams. We look for the same for all family members, and fecal flotation often negative because eggs are in the segments. Here's what these look like. The family Tianidae, this definitive host is a predator mammal, so example being a wolf. Its intermediate host is the prey, basically the herbivore or omnivore mammal. An example of this would be a rabbit. So family Tianidae, several forms of metacestode, so larval stages in the family. So two common important ones are Cystocurus and Hydatid. So family Tianidae, we're going to start with the Cystocurus. So it has one scolex, so one head, so one adult. It has a fluid-filled bladder. It's innervated, invaginated scolex. It has one Cystocurus, which produces one adult tapeworm in the definitive host. So infection disease is called cysticercosis. And here's what they look like. You can see there. And then we have Hatted, which is several scolixes, so several heads to several adults. Has a fluid-filled bladder that lines by a delicate parasite membrane. Its heads detached from wall into cyst fluid. Secondary cysts are formed as invaginations on the walls, and one Hatted produces up to thousands of adult tapeworms. So the infectious disease is called hydatidosis. So that's what these look like, but these produce thousands of tapeworms. So then family Tianidae, we have Tianiformis, which is a common tapeworm of hunting cats. Its eggs shed in segments. Its intermediate host is rodent. Its metacestoid is in the liver. Then we have Tianae pisiformis, its definitive host being canids, so dogs, and the eggs shed in segments, and its intermediate host is rabbits. So both of these, their diagnosis is you see segments. Fecal flotation is quite insensitive. Centrofungal flotation also detects 20% of the infections. And then also in the family of Tianidae is the genus Echococcus, which only have 3 segments all the time. They're very small adults, 3 to 6 millimeters. Their metacestoid stage is the hydad stage, which undergoes asexual reproduction due to being in this stage. Has multiple scolixes formed, potential for thousands of scolixes to form. So their life cycle is northern temperate zone, so northern US, Canada, and Central Europe. The life cycle is the same with the small intestine. The definitive host is the fox, sometimes the dog, but rarely the cat. Its intermediate host is small rodents, including lagomorphs. Human and pigs, aberrant or accidental intermediate hosts, and then we have the metacestoid, so the larval stage being the alveolar cyst, so multilocular cyst. Its clinical importance is sometimes hydad forms in people or dogs. Alveolar echinococcosis or alveolar hydad disease. It's difficult to remove surgically because it grows invasively. New focus of infection is in Ontario and Alberta, and it was recently found in Virginia. So family Tianae, with humans as the definitive hosts, we have Tianae saginata, which is in human and cattle, and then we have Tianae solium, which is in humans and pig. So also in family Tianae, we have Tianae solium and T. saginata. Clinical importance from adults is mild abdominal discomfort, occur worldwide, very uncommon in the US, however. Slaughter inspection, Sister circi is killed by cooking or periods of freezing. It's an endemic case in the US, are rare though. And then family Tianae, so Tianae solium is when humans ingest eggs accidentally, they get cysteria, causes human disease called cysticercosis or neurocysticercosis. They get headache, confusions, and seizures. This leading to cause of adult onset. Epilepsy globally and it's a major problem in Latin America. So yeah, that was a lot of information all at once, but we got through it. But I have to make charts and figure out how I'm going to memorize life cycles and different parasites, so wish me luck on that. I hope you guys had a good Tuesday, and I still have lab to go to, so I love you guys, and I'll talk to you guys tomorrow.